Okay, so now I'm going to be doing my video on assisting with a sitz bath. So a sitz bath is typically used after delivery, and it can also be used to help patients deal with the pain of the hemorrhoids, and if they had an episiotomy in the perineum during their delivery, it can help soothe the area and allow more blood to circulate down there. So I obviously don't have a sitz bath at home, but I can use my bathtub. So I'm going to go ahead and demonstrate using my bathtub. What I would do and the instructions I would give my patient to use when she makes it home and needs to do a sitz bath. But before I go ahead and do that, I'm gonna just talk about the setup with a disposable sitz bath. It's just like a little basin that can go under the toilet seat of any bathroom. And it has a bag that you would hook the tubing through the sitz bath, the basin, and hang using either a hanger, or you can just hang it on the hook in the bathroom. And you would put warm water in it. And the purpose of the sitz bath is to keep the patient's perineum warm, but you also want to keep their body warm as well. You don't want them to be cold. So most times patients would, go into the bathroom with like a black blanket wrapped around their shoulders. The room would be warmed so that it's not so cold, because that would kind of defeat the purpose of the sitz bath. You want them to be in the warm water. The basin would get filled with water, and it kind of just gives them it kind of soothes the area, kind of like when girls have their periods every month, and we use heat to deal with the cramps. The heat helps the blood flow better and eases the pain and discomfort for them. So they would sit, if they were using the toilet, they would sit on the toilet as if they were going to use the bathroom, urinate, or whatever they were going to do. And in the toilet is the basin where the warm water is flowing, and they can literally just sit there. It's very important to be near the patient, especially if it's their first time having a sitz bath, because after so long they get a little bit winded and they can get very faint and become oxygen drops while they're in the bathroom and they're sitting up for so long after delivery. So that's super important. Most times when they're having a sitz bath, you would obviously give them something to keep them entertained, whether it be like a magazine, a diary, their phone, whatever the case may be, just to give them something to pass the time by as they're sitting there, because typically you would sit there for not a super long time, but a decent amount of time, maybe about 30 minutes or so. So that's that. But I would teach my patient, if they aren't able to take a disposable sitz bath home, they could also do it in the bathtub of their home. You would only fill the bathtub to about 4 to 5 inches with warm water. And the same rules would apply. You would sit there in the warm water, submerge your perineum in the warm water just to kind of soothe the area. And then we also have the peri bottles that are given to women after delivery that can be used to, after they urinate, they would go ahead and the water just kind of squirts out of the bottle. It's a little squeeze bottle. The water would squirt out of the bottle just to kind of cleanse the area and soothe the area, because urination after delivery can be difficult and it can be painful. So the warm water can help soothe that. And that's about it with sitz bath. Obviously, before they go in and do the sitz bath, you would give them all the materials they need. It would be their towels, an extra gown, a new peri pad to put on once they're done. And then it's super important that once they're done with the sitz bath, that we use soap and water, clean that out. Obviously, we're gonna have our gloves on, so we clean that out just to keep any infections out. You don't wanna use, just in case they may have got a little bit of uterine bleeding in there following, and you just leave that in there. That can build up bacteria, all kind of things. We don't want any infections, especially after if they've had an episiotomy. We would not want that. So that's really it with sitz baths. Thank you.